Well, good evening. I don't know how you top those sort of intros. That's fantastic. I wish I had the Jeff Rice story myself, but I don't. But thank you, Dr. Smith, and thank you, everyone, for having us here. I think this is the third year now that we've been coming to FMMA, and it's awesome to see that each year it gets bigger and better. So hats off to you for what you've done and how you sort of brought this up out of the ground as an organic grassroots movement that I think we all would agree is desperately needed by this country. So congrats to all of you. Thank you. So you probably have no idea what I'm doing up here tonight. We've discovered something that we wanted to share, and we've not really spoken about it outside of our own four walls back in Nashville. And when Jeff and I were talking about where should we let this be known, this was the spot. So we're going to give you a sneak peek on some things that we've discovered along the lines of where truth and technology meet and what that can do to change the game. But before that, I need some help. So I'm guessing in this crowd it'll take about that long, but what's the most expensive piece of medical equipment in healthcare today? Who said it? The pen. That's right. It's absolutely true. Now, not this pen and not in my hand, but in a physician's hand, this pen drives most of the $3 trillion in spend one way or the other. And about a third of that could be saved as physicians take control back of medicine and grab the power of the pen. So what do I mean by that? If you're a patient, you don't know what your physician's going to do when they start writing or typing, where they're going to send you, what they're going to order, what care, tests, procedures, et cetera. It's opaque to you until after the fact, until after you get the bill for a $5,000 MRI when it could have been $500. Had the doctor just written a different name on the piece of paper and sent you to this place across the street with the same machine, right? Or worse, you don't know what your doctor's doing with your pen, for you or against you, intentionally or not, until you find out 2 months after your knee surgery that you have to have it revised because your physician sent you to a well-known brand name academic medical center that's supposed to be the best in the country at cardiac care, as it turns out, not joint replacement, right? But this is what happens to patients on a routine basis. So tonight, what we've figured out after about a decade's worth of work is what almost every physician in the country does with their pen. As simple as it sounds, being able to show patients where the starting physician or the referring physician or the specialist, where they send the patient through their course of care makes a tremendous difference. So we're going to walk through a beta version of that tonight, and in 2 or 3 months' time, most of the rest of the country is going to see this. And I think it's going to be a good thing. It's a great thing for the folks in this room because you already get it and are doing it. It's a great thing for patients. And for everyone else, we'll see. The truth's going to have its own volume. We'll let the chips fall where they may, and I may not be back here next year. I don't know. We'll find out what happens. So most of you know, I can put my pen down now, that over the past 10 years, we've built a business as an independent source of transparency, serving thousands of employers and millions of consumers and patients, saving millions and millions of dollars. Principally by just making this very simple truth clear and readily accessible to any consumer. And you guys in this room know this, right? That price and quality vary by huge, unwarranted amounts. But most of the folks outside of this room don't know this. They don't know that depending on how the physician uses their pen, it's going to have tremendous consequences for them, clinically and financially, to the good or to the bad. I can get this to click. So think about it from a patient perspective. Raise your hand if you filled up your car in the last month. Just about everybody. You didn't fill up your car last month? Okay, I thought so. All right. Anyone driving a Tesla? That's a separate conversation. Raise your hand if you paid 20 bucks a gallon for gas. No one? Really? 10 bucks? 5 bucks? Awesome, way to go, way to go. You and I got a lot of business I want to do with you after this. So, and no one even probably paid 4 bucks or maybe even 3 bucks, right? Because you'd never do that. But that's what's happening in healthcare with price variation. You don't know that you're filling up with $20 a gallon of gas till it's too late. But it's a step worse than that. So let's say you're that person who uses the company card, you don't care about price, and you like having someone else fill up your tank. You like it when they wash the windshield and they check your tires. So you go to the full-service gas station, you say, fill it up, you pay him 20 bucks a gallon. He comes and says, you're done. You pay him 400 bucks for a tank of gas, and you drive out, and before your car gets out of the station, the engine seizes and dies because they put diesel instead of unleaded, right? And that's the other side of the story for consumers and for patients, is it's not as simple as send me to a good hospital or a bad hospital. What we know, and this is data from one of our Nashville brand name facilities, is that inside the hospital, there's tremendous variance as well. So not just between facility to facility. Most hospitals do most things. Almost none are excellent at everything. So this one has an excellent, well-earned reputation for orthopedic care. And guess what all of their billboards in town are about? All it says is #1 hospital, tiny, tiny print, orthopedics, right? So that brand is everywhere. And a lot of folks go there, as they probably should, for orthopedic care when it has to be inpatient. They also, unfortunately, receive a lot of cancer care patients. The docs don't know, the people don't know that they are at the bottom of the barrel in that category. So putting those two things together as a consumer or a patient, you're kind of scratching your head going, where do I start? What do I do? And most of us would like to trust our physician to say, figure this out for me, and just send me to a place that's good for me. Use your pen to write an order, referral, et cetera. It's going to be good for me clinically and financially. But we know that's not what happens. Some physicians use high-value facilities, some don't. And that's the crux problem. So you've seen this probably before if you've heard us speak, that it's not the physician that's the problem. The physician has lost control in many cases. They've given up the power of the pen to someone else. But the physician cost is not the problem. So this is data from one of our large self-insured employers. Each one of these horizontal lines is a claim for a colonoscopy. And when you look at the claim line, there's two components, right? There's the green, which is what the facilities paid, and the blue, which is what the physicians paid. And this is in-network, in one market, in 1 year before this employer had Bluebook. And you can see some folks paid over $4,000, some folks paid under $1,000. But when you break it apart, you see that the physician component doesn't vary as much as you might think. There's an outlier up top, but by and large, pretty close together. But where they send you is going to make a big surprise. So where do you go from here? And this is not rhetorical or made up. This is actually what people do. When they're trying to find a doctor that's going to do the right thing for them clinically and financially, use their pen in the right direction, where do you start? You ask a friend. That's what most people do. Maybe you know a doctor. You ask them. But guess what that friend or doctor is going to do? They're going to tell you what maybe they heard from somebody else or what they saw on WebMD or on Yelp. And Yelp is based upon stars of, yeah, I liked the waiting room. I liked the drive-up parking. Where do you actually start? And there hasn't been a place to objectively identify which physician at the starting point through your course of care is going to help you end up in the best position clinically and financially. Until now. So we've spent about a decade crunching through this to understand something we didn't realize we needed to understand, which is how do physicians use their pen. So after mapping data across the country, we've mapped and rated just about every physician in the country on something as simple but as powerful as that, is how do they use their pen. And what I'm going to show you here in a minute is just a beta version, so the UI and other things are changing. But as a result of doing this work, we're able to deliver what we now call Provider Connect. And at a glance, a patient can see how the physician uses their pen. Do they by and large use it to send me in the right direction clinically and financially, or not? And what about the facilities they use from a cost and quality basis? So if you put yourself in a patient's position and figure out how this works, let's say you have realized that it's time. You need to have that knee replaced finally. I think I'm stuck here. There we go. And true to form, you ask a friend, family physician, who do I go see? They give you a name. Now you can actually look. All right, how does this physician do, and what do they do, and where do they do it for total knee replacement? And what you see pretty quickly is that, wait a minute, they typically use a facility that has fair to middling on quality and high on price. But moreover, there's a facility in my backyard that's the highest ranking for quality, and as Dr. Smith was saying, also most cost effective. And we see that not uncommon, that the highest quality facility or provider is often the most cost effective. It makes sense if you think about what goes into error rates and problems. So you hit pause, because even if you're not paying the bill for this, you don't want to go to an average quality facility if you can help it. You want to go to the highest quality facility. And we all know that for inpatient care in particular, the constellation of things that happen around a patient besides just the surgeon or the physician are significant. Slips, falls, medication errors, infections, the things that determine whether you come out of there standing up or on a gurney are related to the facility. So it's important to understand that component of it, not just the physician. So as a patient, I want to know, okay, exactly how good are these guys? So by crunching through all of the CMS MedPAR data set, risk adjusting it, volume adjusting it, et cetera, we're able to tell a patient, not how good is this hospital overall, not what's their brand or their billboard or their US News and World Reports ranking, but for knee replacement, how do they fare? This one's 96% across all hospitals in the country. So they're better than all but 113 hospitals out of 3,400 across the country. In clinical outcomes, and just for total knee, bear in mind, clinical outcomes are not the same as patient satisfaction. So we break those out by design. Because free valet parking and Wi-Fi are great, but I'm much more concerned about, do they do the right knee and do they do it right the first time? So fine to show this, but do not conflate or confuse the two. So all right, as a patient, I'm saying, okay, I get it. This is interesting. Who does practice there? And when you look at this case, Dr. Adams, true to form. And these are all real folks. We did them in a different city to avoid any in-room riots. He actually performs his cases at the highest quality facility in the area. And it also happens to be the same one with the great price. So as a patient, you can have a fighting chance to understand from a data-driven perspective, what does the doctor actually do? They may have privileges at 15 different places, but where do they send all their cases? And here you can actually see this guy has privileges and performs his cases at this facility. Now for folks outside of healthcare, you kind of go, well, duh, anyone can look that up. No, you can't. You try. You go to a health plan site, you go to any provider lookup tool, you might get demographic information, you might get star reviews of whether this guy is nice or speaks a second language. You cannot see how they use their pen until now. So if the patient says, great, I'm in, they can Bluebook it right through the app or through the website, and they're on their way down the right course for a very different clinical and financial reality than had they started with a person that their neighbor or their golfing buddy said, oh, he's great, go see him. He may be a great guy, but he uses the wrong workshop. All right, so that's Provider Connect. Where do we go from here? Before I jump into that, any questions, comments, feedback? And I want to get you guys back to dessert and cocktails. Yes? How do I come up with the quality standards? Yeah, great question. So the quality comes from CMS MedPAR data, so the largest data set in the country. We take that, we're able to risk adjust it and volume adjust it, and then slice it by clinical category and use multi-dimensions of scoring. So mortality, morbidity, adherence to core processes on down the line. And then look at folks relative to who's in their market and then nationally. And that's refreshed by CMS once a year. Yeah. Yes? It's a great question. How much do the providers know about the cost of the facility? Folks in this room know real well. Outside of this room, pretty hit and miss. It's surprising. So I think a lot of what's going on in terms of the misuse of the pen, there's some ignorance, there's some convenience, there's some getting leaned on by hospital systems. I don't think by and large it's intentional to try to damage the patient's pocketbook. It's not their money, it's not their recovery time, they're doing what they do. Yes, please.
You answered about the quality side. What about on the patient satisfaction? Where are your data sources for that?
Our patient satisfaction data is as bad as everybody else's. So here's what we've got. We use, we reference health grades because they're a large data set, so you can pull in the health grades data. On the facility-based pieces, that's HCAHPS, which is the CMS survey. The challenge with patient satisfaction is unless you've got a truckload of results, it's really very skewed. And even on those sources, you might see 3 or 4 people have reported, and that's hard to really draw a conclusion on a patient, or on a physician rather. Yeah?
Do you have an API so that we can attach with your website and maybe get our patients to help us out?
Did they plant that question?
I didn't hear that.
Did they plant that question?
Oh,
That was
no.
like right on cue.
Oh, there you go. Thank you. You know my room number, right? Yeah.
What's that? He asked if we have an API. So as a matter of fact, we do. And that's what I wanted to talk about as well. This is important to get the word out, not about Bluebook, but about transparency. You guys are the good guys in the room, and you're not getting enough recognition for the work that you do or enough business for the work that you do. So what we've done, and we're going to do this all together in a minute, is we've created a widget which allows people to search like they'd normally search on Bluebook on your site, to drive traffic to your site for folks to get information on cost and quality of care. So what we're all going to do, if you would, is take out your phone. And this is kind of that rock concert moment, right? So you've done this before in different places, different ways, doing different things with lighters. Now do it with your phone. And all we're going to do is open up your text app. And for those of you that are good at it, help the person next to you who's still struggling with their knife and fork over there at table to my left. There we go. And you're just going to type in 41411. And in the message box, all you're going to hit is My Bluebook. All one word, My Bluebook, no spaces, capitalization doesn't matter, and hit send. And what that's going to download to you is just a link that allows you to pull down this kit, this transparency kit, that has the widget you can place on your site if you like, so that people can search for fair prices directly from your site without having to go elsewhere. And it also has some basic information about what's happening with what we call price blindness in the market, as well as important things for consumers to understand about where transparency is going. Because make no mistake, the whole point of this is to help the good guys win. And it's time, right? The way physicians are using or not using their pen is costing this country over $1 trillion in waste. But more importantly, it's costing patients and their families and their loved ones consequences, good and bad. Sir?
Is the site monetized and how so?
It's a free site. We have a premium site. This site is a free site. We have no ads on it, totally free. The premium version of the site, how we get paid, is a site we sell to self-insured employers, and self-insured employers pay the bill, and there's more detail on that site specific to them. Yeah. Any other questions? Yeah. Nope. The question was, can doctors or hospitals take their name out of the hat? Nope. They're on. If they're on, they're on. Thank you. Thank you very much for your time. I appreciate it. I'll be around as well, but go back to your cocktails and dinner. Thank you.